This is Dr. Goel, Assam Goel MD Medicine. I'm making this trying to educate public, everybody about cancer risk factors in our community. I talked about diabetes in a other video. In this I'm talking about smoking. um, देखिए आप माने ना माने, almost when you just smoking by itself causes 20% of all cancers, and almost is responsible for almost all 30% of the death due to the cancer just because of smoking, no other reason. Actually, as far as obviously lungs are the most common place where cancer happens, and almost 90% death of the lung cancer because of the smoking. So it causes, smoking causes, it has a lot of factors in it which can lead to cancer and cause a lot of cancers. There is a lung cancer, of course, but it can cause cancer of bladder, about kidney, about liver, pancreas. So what the smoke or tobacco, smoke or tobacco smoke it has some things in it in smoke which damages the DNA of the cells. So DNA of the cells is affected or damaged, so cells starts growing like cancer. So that's why you may have cancer. Your lung is obviously most affected because most of those factors smoke goes into the lung DNA. So cigarette smoke actually have about 7,000 chemicals which damage DNA, and it also decreases our immunity. And obviously, smoke, it has smoking has, if you try first time you see, is very irritating to the our lung system. People get used to it. So what kind of cancer smoking can do? Smoking, obviously lung cancer, almost 90% cases of lung cancer because of the smoking, but it can cause any kind of cancers. So it can cause bladder cancer, pancreas cancer, stomach cancer, in women's female cervical cancer, liver cancer, you name it. And if you say I will smoke less, no, nobody is protected. Even if you smoke less, risk is there, significant risk is there. Well, and also, duration does matter. Obviously, more months and years you smoke, there is it becomes a very strong risk factor for the cancer. So you got to understand, you got to stop it as soon as possible. Do everything to try to stop it. It's not worth it. Also, prevent yourself from second exposure, like you are standing right next to the person. And it is a medical fact. If you stop smoking now, after so many years, you did not have a cancer, your risk getting the cancer dramatically goes down. So another thing is, if you have a cancer, you say, oh, I may continue to smoke. No. If you still have to stop smoking because cancer treatment becomes difficult. Then it's very difficult to cure cancer. You are still smoking. So please understand all these facts and do your best to quit smoking.